Hi everyone, today we are going to discuss about fatty liver disease. Nowadays fatty liver disease is getting more and more common, especially ultrasound being done in a male or female for umpteen number of procedures. Because many times previously ultrasound used to be done daily or routinely in pregnancy only. Nowadays ultrasound is done for any pathology. Suppose a female comes of a polycystic ovary, uterine fibroid or any complaints of abdominal pain, and a male comes with any abdominal pain, doctors first ask for an ultrasound abdomen. Now, Indian studies have shown that 30 years and above, you do ultrasound abdomen for 10 patients in India or 10 people walking on the road in India above 30 years, 7 out of 10 people have some sort of fatty liver disease. So when you do an ultrasound, the grade of ultrasound of fatty liver disease, they divide into grade 1, grade 2. Sometimes they write as grade 3 or grade 4 fatty liver disease. That is fatty liver grade 1, 2 is okay. 3, 4, they think that the hepatic echo text is changing. Probably the patient is going to cirrhosis. Whenever a patient gets an ultrasound report of fatty liver disease, the patient goes into panic. Previously, people used to go in panic. You hear about diabetes, you people hearing about thyroid. Now people go into panic hearing about liver disease and fat liver disease because so much social propaganda that fat liver disease will go on to hepatocellular carcinoma or liver failure or cirrhosis of liver. So what is the etiology of fat liver disease? Fat liver disease is divided into, number 1 is alcoholic fat liver disease or ASH. Number 2 is the vast entity where 80% of people with fat liver disease are actually not alcoholic, not having jaundice. They are having non-alcoholic fat liver disease, that is known as NAFLD or NASH. So suppose a boy or a girl or an adult male or a female is doing ultrasound abdomen for any procedure, he or she is diagnosed as a grade 1 to grade 2 fat liver disease. How do you go forward? First, you ask the patient whether you're an alcoholic or not. Patient tells, no doctor, I've never taken alcohol in my life. Second, you ask the patient whether you have any history of jaundice or hepatitis. Patient tells that, no doctor, I've done visa procedure every 2 years. I'm doing visa. I'm doing my hepatitis B, C. So you know that there is no chronic liver disease due to hepatic viruses. So fat liver disease, 30% is due to alcohol or hepatic viruses causing liver disease, hepatitis B and C. Rarely it can be congenital disease. Iron being deposited in the liver, that is known as hemochromatosis, or copper being deposited in the liver, that is known as Wilson's disease, or rarely autoimmune hepatitis B. 10 people having ultrasound showing fat liver disease, 3 out of 10 only have hepatitis B, C, hemochromatosis, or copper being deposited Wilson's disease, or antibody mediated autoimmune hepatitis, or alcoholic cirrhosis. 7 out of 10 people with a fat liver disease are actually having non-alcoholic fat liver disease. So what's the cause of non-alcoholic fat liver disease? It is ultimately due to your weight gain or abdominal obesity. Many of the females who comes to the OPD after delivery, they tell the doctor, when I married, my weight was 50. After 2 pregnancy, my weight is 70. Many times they have belly that is protruding like anything. You do an ultrasound abdomen, it shows grade 2 fat liver disease. That means that the abdomen is filled with fat. So your liver that is sitting inside there is also filled with fat. So how do you treat a patient with fat liver disease? Number 1, you ask the patient alcohol, hepatitis B and C, that is negative. You ask the patient to do a liver function test. So liver function test mainly we do SGOT, SGPT, alkaline phosphatase and GGT. Suppose a lady or a guy is doing an ultrasound abdomen, it shows a grade 2 fat liver disease, but liver function SGOT, SGPT, alkaline phosphatase, GGT, everything is normal. It is nothing, a benign condition, non-alcoholic fat liver disease, NAFLD. You ask the patient for a diet, exercise, weight loss. Second scenario, a boy or an adult at the age of 35 years, a young lady after pregnancy 30 years is doing ultrasound abdomen. It shows a grade 2 fat liver disease. She is asked to do a liver function, SGPT, SGOT, alkaline phosphatase or GGT is elevated. It is a NASH or a non-alcoholic steatohepatitis. You have to treat a NASH with diet, exercise, weight loss, which reduces NASH in 31%. What are the other treatment options for non-alcoholic fatty liver disease with elevated liver enzyme? Diet, exercise, weight loss reduces NASH by 31%. The tablet for diabetes or insulin resistance, metformin, glucophage, 850 mg BD reduces NASH by 58%. But now the drug of choice of non-alcoholic fatty liver disease is another tablet for diabetes, that is known as pioglitazone or Actos, which reduces NASH by 75%. The cholesterol lowering drug of statin, the Lipitor, Crestorovirus, and vitamin E, which is used as a vitamin fat soluble vitamin 400 mg BD, and the weight reducing the Orlistat, it reducing the Orlistat reduces NASH by 20%. So basically for common man knowledge, 100 people having a non-alcoholic fat liver disease, ultimately we know that 75% of the people having a non-alcoholic fat liver disease doesn't die of liver cancer, they die of a heart attack or a coronary artery disease. 20 people out of 100 die of cancers other than liver cancer, CA breast, CA colon, CA endometrial. Only 5 out of 100 people having a fat liver disease die of liver disease or a hepatocellular carcinoma. So fat liver disease is a fat deposit in the liver, but it's not a disease exclusively limited to the liver. 100 people having fat liver disease, 75 out of 100 ultimately die of a heart attack. That is why whenever you find a fat liver disease in ultrasound, you always do the HbA1c, the 3-month average for blood sugar. If it is more than 6.5, treat with an Actos or a metformin. You do the BP. If BP is more than 130/85, you take a losartan, telmisartan, olmesartan to get BP less than 130/80. You check the lipid profile. If the bad cholesterol LDL is more than 70 or triglyceride is more than 150, you treat that. Because fat liver disease is just showing that there is fat in the liver. The same fat is deposited in your heart, coronary artery, in your cerebrovascular blood vessels, and ultimately 100 people having a fat liver, 75 out of 100 die of a heart attack. So with fat liver disease, your exercise should be there, your cholesterol, your BP, and your metabolic syndrome with metformin Actos should be controlled. 5 out of 100 people with fat liver disease only die of a cirrhosis. So whenever you find a fat liver disease, go to a physician, go to an endocrinologist, go to a cardiologist, ask them if it is a fat liver disease, non-alcohol, BP, and your metabolic syndrome with metformin Actos should be controlled. 5 out of 100 people with fat liver disease only die of a cirrhosis. So whenever you find a fat liver disease, go to a physician, go to an endocrinologist, go to a cardiologist, ask them if it is a fat liver disease, non-alcoholic, how to go forward. If exercise is not controlling, take a vitamin E, 400 mg BD. If that is not controlling, take a metformin, glucophage, or an Actos which reduces NASH by 75%. So get aware about fat liver disease. It's just the tip of iceberg that your body is having excessive fat, excessive cholesterol, excessive BP, excessive HbA1c, that is metabolic syndrome. Get corrected and live healthy till the age of 80, 90 or 100 years. Thank you.